We will be discussing herbal medications and its effects on osteoporosis in the elderly population. Herbal medicines are products made from botanicals and plants that are used for nutrition, treatment of diseases, and maintenance of health.
Hi, my name is Martha, and I'll talk about how herbal medicine are being sold and used. The herbs come in all forms. They come dried, chopped, powdered, in capsule or liquid. And they can be used in various ways, including swallowed as pill or powder, tincture brew as tea, applied to the skin as gel, lotion, or cream, and added to bath water. Common misconception about herbal medicine. People believe that the more dose, the better. One thing many people think that because supplements are being sold as over the counter, they are safe and can be taken in high dose. In reality, high dose of vitamins, minerals, and supplement can be harmful and can lead to toxicity. Myth number 2: herbal supplements are natural, so they are safe. All supplement claim to be natural are not always safe or better. Plants or botanical products contain chemicals that may be harmful to humans, since they may not be refined to remove potential harmful chemicals. Myth 3: it has been used for thousands of years, so it must be worth. Knowing that it has been used for years is helpful, but it is not enough to prove that it is safe. However, one thing we have to consider is that traditional systems did not have the science method to detect the long-term effect of this herbal medicine. Myth number 3 is that it's not harmful to take supplement along with regular medicine. So people assume that it is safe to take herbal medicine with prescribed drugs. This is not always true. Some botanical products can block or speed up drug absorption. So definitely this can lead to too little or too much drugs in the bloodstream. So it's essential to talk to a doctor or pharmacist about knowing about any known interaction. I'm sorry. The FDA will not let them make that claim if it was not true, and if it could hurt, they will not be allowed to sell it. In reality, the FDA do not check every claim made about a supplement. Therefore, safety is up to the manufacturer. And FDA only stepped in when they are aware of any problem.
Many ancient cultures used and practiced herbal medicines, including ancient Egypt. Ancient Egypt was one of the very first ancient civilizations to use and practice advanced forms of medicine, including herbal medicine, dating back to around 3000 BCE. The Egyptians had advanced knowledge of human anatomy and physiology, most commonly known from their mummification ceremony. Their medical practices focused on the examination, diagnosis, and further treatment of conditions, much like we do today. In some cases, however, they understood that some diseases or conditions were not treatable and knew when a patient was beyond their help. Many things that they were to treat, they could see easily on the outside, such as like a wound on the outside of the body, but things that were internal were harder for them to treat as they were not aware of certain internal diseases at the time. Herbal medicine in ancient Egypt also included the use of many herbs in Egyptian medicine and treatments. Some key ones listed in the famous Ebers Papyrus include, but are not limited to, henna, castor oil, myrrh, cannabis, and opium. Henna was thought to aid in hair growth, castor oil thought to help with constipation, and myrrh was a very important herb in the embalming process, specifically because it was burned as incense. Much to scholarly conflictions in today's literature, Egyptians also practiced medicine that was deeply rooted in supernaturalism, assuming that the cause of disease was the consequence of sin, that disease and sickness were caused by an evil force entering the body. Some of these magical treatments included spells or incantations, amulets and offerings, aromas, or even tattoos in an attempt to drive away the ghost or demon.
Some herbal medicines and their treatments. Blood cohosh. Blood cohosh has been used by Native Americans for so long. This herbal medicine contains phytoestrogens, that is, estrogen-like substances, and it helps to prevent bone loss. Hostel. Hostel is also another herb that is also believed to prevent bone loss and stimulate regeneration because of the silicon it has. Tai Chi. Tai Chi is an ancient Chinese practice that uses body postures that flow smoothly and gently from one to the next. Saicha use is to improve muscle strength, coordination, and reduce muscle or joint pain and stiffness. Soya, which is soya beans, the soya we use for our beans, is also believed to contain isoflavonoids that are estrogen-like compounds that help protect bones and stop bone loss. Dongqiao. Dongqiao is also an ancient Chinese practice. It is used to prevent bone loss and help to build bone strength.
Research shows that there are many beneficial factors with taking herbal medicine for diseases like osteoporosis. One study looked at the effects of Chung-Ah-Wan, or CAW, a Korean herbal medicine in women with osteoporosis. They found that CAW is used as an estrogen agonist for treatment of postmenopausal osteoporosis. Estrogen inhibits osteoclastic bone resorption activity. Therefore, estrogen deficiency can cause a bone loss and weakness of balance between the bone resorption and bone formation. It enhances bone metabolism by adjusting the VDR mRNA expression, which helps in preventing bone weakness. Eucomia is one of the herbal components of CAW and prevents estrogen deficiency-induced bone loss and deterioration. And Passoralea is a herb that treats bone fractures and joint diseases by stimulating local new bone formation by increasing the function of osteoblasts and is useful for treatment of bone loss. Another study focused on the benefits of traditional Chinese herbal medicine. Researchers found many different herbs within Chinese medicines that have been found effective in treating osteoporosis. Achiranthus bedentata reinforces muscle and bones, enhances bone strength, prevents deterioration, and prevents loss of bone mass by decreasing the level of bone turnover markers. It's also effective in preventing and treating retinoic acid-induced osteoporosis and was found to induce proliferation and differentiation in bone marrow stromal cells. Rhamania glutinosa promotes the proliferation and differentiation of osteoblasts. An active compound within Rhamania glutinosa is called actioside, which is responsible for inhibiting osteoclast differentiation and maturation from bone marrow macrophages. Angelica sinensis is a commonly used herb in China. It's an herb that increases the bone femur mineral density and decreases the markers of bone turnover and osteoporosis. Most commonly reported to possess anti-osteoarthritis properties. Here are a list of additional traditional Chinese herbal medicines that have been found useful in preventing and treating osteoporosis. Cornus officinalis seboid and zook is a folk medicine with a long history of safe use for the treatment of osteoporosis. Astragalus membranaceus is a tonic used to strengthen muscle and bones. It is one of the most widely used medicinal herbs in Asian traditional medicine. If combined with supplemental calcium, it is more protective against loss of bone. Cinnamomum cassia is a traditional oriental medicine that has direct stimulatory effect on bone formation in vitro and may contribute to the prevention of osteoporosis and inflammatory bone disease. Dipsacus asperwall is used for the treatment of traumatic echinoma and injury of muscles and bones by strengthening bone and curing bone fractures. It has also been used for treatment of back pain, traumatic hematoma, and bone fractures. Treatment with D-asper extract is reported to have a positive effect on some of the following: mechanical strength, BMD, BMC, bone turnover markers, and significantly prevents the reduction of bone volume fraction. Polygonium multiflorothum is effective in protection against osteoporosis associated with oxidative stress. And lastly, Saninum moneri is a traditional remedy that has been confirmed to be effective in the treatment of osteoporosis. It induces bone formation and promotes osteoblastic activity. Chinese herbal medicines such as Herba epidemi, Radex romana, Radex astragali, Rhizoma drenari, Salvia mycorrhiza, Fructus passorale, Radix pereiri, Radix angelica, and Cortex humome are the most common types of herbal medicines used to treat osteoporosis. But Herba epimedi and Radix romana are major herbal medicines that are most frequently used in the herbal combination. Some Western medicines found to be effective against osteoporosis include estrogen agents, vitamin D, calcium, and thyrocalcitonin. Estrogen treatment is used only in female osteoporosis patients. It inhibits bone turnover to prevent bone loss. Vitamin D is needed by the body for calcium absorption and participates in bone mineralization. Calcium is an essential nutrient for normal tissue formation and mineralization. It is required for the prevention of osteoporosis, especially in primary osteoporosis in the elderly and in postmenopausal women where estrogen deficiency can cause bone loss. Calcitonin is an important hormone in the regulation of calcium metabolism, and it reduces osteoclastic activity motility and slows down the maturation of osteoblasts, thereby inhibiting bone resorption. Using those in combination with Chinese herbal medicines have shown to prevent and treat osteoporosis in individuals. There are no current studies that have proven herbal medicine to be harmful, risky, or non-beneficial to patients with osteoporosis. However, some general disadvantages of herbal medicine include side effects, interactions with other medicine, and the risk of safety. With any medication, even herbal medication, comes side effects. There can be allergic reactions, rashes, asthma, headaches, nausea, vomiting, and diarrhea. Herbal medicine can also decrease the effectiveness of other drugs the individual is taking and increases the side effects due to drug interactions. It is important to purchase herbal medicine from a reputable practitioner or pharmacist and have it prescribed after consulting with your doctor to avoid receiving unregulated herbal medicine and supplements that could be harmful to your health, as it may contain dangerous substances such as lead, mercury, or arsenic.
For a patient teaching about herbal medicine, herbal supplement can interact with conventional medicine and have a strong effect. Definitely, it's important to not self-diagnose. So it's important to talk to a doctor before taking any herbal supplement, so they can be able to advise you which one they are safe and which one can interact with the current treatment that a person can have. Educate yourself. Learn about the herbs by consulting a doctor and contacting the manufacturer for information. And as you do the research, it's important to ask yourself, is the manufacturer involved in the research of its own product? Does the product label give all the information about the standardized formula, the side effect, the ingredient, the direction and precaution? Is the label full clear and easy to read? Is there a toll-free number and address or a website address listed so consumer can find out more information about the product? Always follow the information on the label, read the label carefully, and use the prescribed dosage only. Never exceed the recommended dosage. It's important to seek out information about who should not take the supplement, because some supplement may be harmful to certain people with certain conditions. Work with a professional. Always seek out the service of a trained licensed herbalist or naturopathic doctor trained in this area. Definitely talking to someone who know more about the science, who know about the area. It's always a safe route to take. Watch for side effects. If symptoms such as nausea, dizziness, headache, or upset stomach occur, reduce the dosage, stop taking the herbal medicine, or go see your doctor. And be alert for allergic reaction. A severe allergic reaction can cause trouble breathing. Definitely, if someone has an anaphylactic reaction, it's very dangerous. So it's important that if any reactions as such occur, it's important to call 911 and immediately send the person to emergency.
Cultural competency goal to achieve herbal medicine. So one cultural competency goal to achieve is to respect and have tolerance for cultural differences. This goal can be achieved by health professionals trying to understand. Like if you ask a patient whether they use any herbal medicine and they tell you yes, you just don't have to start by telling them the race from those medicine, but you just have to ask more questions to know the reason why they're taking those medicine. Maybe they have a spiritual belief, maybe it's a generational belief that has been going on 2 generations. And if you're able to give the patient the chance to tell you, then you are able to know, and that means you are giving respect for them and you are tolerating the culture differences, instead of you just going ahead and telling them it is not right for them, it has all the side effects and everything else.
For our intervention, postmenopausal women as well as women already diagnosed with osteoporosis will begin using herbal supplements that has been reported to prevent bone loss. The herbal treatments that will be used are black cohosh, horsetail, and different Chinese herbal medications. The herbal medications will be given along with proper diet and weight-bearing exercise. If the patient's already prescribed medication to treat their osteoporosis or other ailments, herbal medicines will be given in conjunction with the Western medications if compatible. After implementing the interventions, patients will be closely monitored for any changes in bone loss. Patients will also be told to report any bone fractures or bone injuries that occurred after the interventions. A decrease or no changes in bone loss, as well as lower incidences of bone fractures and injuries, would mean that our interventions were successful.